5-minute chat. We haven't done one of these in a little while.
Yep.
So this month, October, we've been focusing on pregnancy preparation in terms of your core and your pelvic floor.
Yep.
So Katie,
yes.
give me one thing that patients come in when they're pregnant that they're concerned about in terms of their pelvic floor and their core.
I would say that sometimes they come in concerned about urinary incontinence, either during pregnancy or after delivery.
So they're leaking during pregnancy.
Yep.
And so what are some of the benefits that we offer as pelvic floor physios in terms of like coming to see us if you're worried about that during pregnancy?
We actually have some really great, not me personally, but we have great research demonstrating the effectiveness of learning how to contract your pelvic floor muscles during pregnancy in an effort to reduce leaking while pregnant.
Which is awesome.
But also we see that kind of slide over to the postpartum period, and that it can make your recovery that much more effective. And so I would say, 1, you're building muscle mass, but 2, it is so much easier to learn how to contract your pelvic floor, like how to Kegel while pregnant, than to learn that brand new maneuver after postpartum when you've already delivered and you're tired and the muscles have been stretched and there might be stitches in there. And so that's something that I think that we discuss commonly. Come into the frame, friend.
I know. Well, I feel like I'm just I drank coffee, so I feel like I'm breathing. So I know what the next question is going to be, and I'm playing devil's advocate here. Is that, do I have to have a vaginal exam if I want to do that when I'm pregnant?
You do not have to have a vaginal exam. I think we're pretty effective at treating externally. I mean, certainly there are some candidates that that would qualify to have a vaginal exam if they wanted to, but it is not necessary, especially during pregnancy. We are strong supporters of that in the postpartum period, but there's lots that can be done from an external standpoint that doesn't have to be a vaginal exam.
Yeah, and like lots of times, like if we meet somebody for the first time during pregnancy, it's like a lot of education, which is why we created a masterclass. So we'll put it, I don't know, there's a link in our bio actually already. You can go download it. 60 minutes, and we literally cover the most common topics that people come in and ask us about during pregnancy, and we start to provide like a little bit of entry education to that. So if you're wondering if you should come see a pelvic floor physio during pregnancy, go watch the masterclass.
Yes.
You'll see the topics that we commonly get asked about, and then if you have more questions about it, then it's a great
We're back.
I talk with my hands.
Eryn talks with her hands too much. It's okay, guys.
Slamming the table.
Oh my gosh. She was very passionately discussing how you should go see our masterclass, because we discussed a lot of things that other people are passionate about when it comes to pregnancy and postpartum. I think other things like perineal massage, a lot of women
vaginal tearing,
are really scared about vaginal tearing. And I will say this beforehand, before you even go look at a thing, the risk of having a high degree vaginal tear is incredibly low. It's very, very low. But I think it's very comforting to learn some education around that and some techniques that might help reduce your risk of having a high degree tear, and just understanding that process a bit better and what recovery would even look like.
And if it's something that you're worried about, you don't have to be passive in that worry. Like, there are things you can do to like better prepare your pelvic floor for a vaginal birth. And that what I find where we like people, sometimes we see them postpartum, they're like, I wish that I had known I could have done that when I was pregnant. And so that's why we created the masterclass. So go download it. Try not to slam the table again.
Although that
I would say quickly, diastasis, because I don't know how many minutes we're at.
Abdominal muscle separation
is another big concern during pregnancy. And so to your point about the vaginal tearing, I tell everybody it is a normal part of pregnancy. Like 100% of people by the end of the 3rd trimester will have some widening. Thank goodness, because like where else would the baby go and your uterus go? But then we kind of talk about some strategies, particularly if they're maintaining like a high level of physical activity, just because that changes intra-abdominal pressure. We talk about, do you need to modify your exercise? Are there things you should be thinking about when you're exercising? And then what should we be doing postpartum? Because that's where I find the education really comes in, as we start to kind of educate them about, okay, if that's what you're doing during pregnancy, let's think about the plan for postpartum, particularly if you want to get back to exercise fairly quickly postpartum.
All right. So we good?
I think so.
Go download the masterclass. It's for free. You can see how it goes. Eryn will make you guys seasick if I keep moving the screen.